Hello, everybody. This is Dr. Myckatyn. I'm a plastic surgeon at West County Plastic Surgeons of Washington University, and I am coming at you live today, and we're going to be talking about male plastic surgery and in particular gynecomastia. Before we begin, I want to give a shout out to our West County Plastic Surgeons of Washington University cycling team that we co-sponsor with. Here we go. Barnes West County Hospital. And this is a cycling team for this weekend's Pedal the Cause event that's happening through St. Louis, where you can cycle 25, 50, 100 miles if you're so inclined, to raise money for breast cancer and all sorts of cancer research. So please, if you know anybody riding, we strongly implore you or ask you to support them, as every little bit of money helps towards cancer research. All of us have been touched by somebody who's had cancer, so please sponsor someone. If you don't know who to sponsor, please sponsor our team. We're called Rowdy Riders, West County Plastic Surgeons, Barnes West County Hospital. All right, so let's get to our first couple questions. So what is gynecomastia? So gynecomastia is essentially development of excess male breast tissue. Gynecomastia is actually kind of a normal thing that happens to the majority of adolescent males, and it really kind of starts during puberty, and it is an entity that normally goes away after about 2 years. So if you have an adolescent friend or child, for example, who's developed that, that's normal. And it's not really until it doesn't go away after a couple years that we would necessarily consider that gynecomastia. And that's really the true definition of this. Gynecomastia can occur on one breast or on both. We see either. And there's other versions that we call gynecomastia that have a little bit different meaning. Some folks, it's that they've gained a lot of weight, and so they have a lot of extra skin that develops. Some people, it's related to medications. So there are some medications that are used. There's some anti-seizure medicines, some diuretic medicines, some blood pressure medicines, and anti-reflux medicines. It's also associated with marijuana use, with anabolic steroid use as well. Gynecomastia can also be associated with problems with the endocrine system, particularly hormonal changes. So certainly there can be issues with certain rare forms of brain tumors, although that's very rare. Testicular masses or testicular cancer as well. So, you know, if gynecomastia kind of shows up at later times in life, it's not a bad idea to be evaluated by your primary care doctor or endocrinologist. Sometimes some simple blood work is done just to make sure it's not caused by one of those other things. The majority of gynecomastia causes are actually idiopathic, meaning we really don't know what caused them, and it just kind of came up. So those are kind of the classifications of that. And I'm just looking at my feed here. So if any of y'all have questions, please feel free to ask them, and I'll try to respond the best I can. But I'm going to move on to, so how is gynecomastia diagnosed? So we talked about that a little bit, but basically, you know, it all starts with what we call a history and a physical. So in terms of the history, again, we want to know when did it start? Is it something that kind of came upon suddenly? How long has it been there for? What age did it develop? We're going to want to know what sort of associated medicines somebody's on. Again, if there's any other associated medical problems, we'll ask about things such as the thyroid. We'll ask about males' testicular exam. Also, we talked about the liver, brain as well. It's also interesting, gynecomastia has sort of two peaks. We call that bimodal. In other words, it occurs in adolescence and young adulthood. And then there's also a second peak that occurs much later on in life in elderly men. It's actually also associated with lung cancer in older men. So then in terms of how is it diagnosed? So essentially physical exam. Sometimes we will do imaging studies as well to make sure that there's no other concerns. It should be noted that some men can develop breast cancer. It's very rare, but it can develop. So sometimes if there's an isolated mass in the breast, particularly in a man who has a strong family history, either of other men in the family with breast cancer, a strong family history of female breast cancer or ovarian cancer, that will also send them sometimes to a surgical oncologist to get that checked out. And that can include imaging studies, that can even include mammograms and ultrasounds. So in terms of how it's treated, we'll talk about how it's treated and what the recovery is for the various treatments. So in general terms, as a surgeon, first thing, of course, we want to make sure that there isn't some other underlying medical problem that's causing the gynecomastia. So that gets treated first. But once that's been taken care of, as a plastic surgeon, we're looking at this in terms of, is the problem that there's too much skin or that there's too much volume, or sometimes both. So for example, if you have a young, thin male, what'll happen with that person, they don't have a lot of extra skin, but they'll just develop a mass of tissue. That tissue is usually pretty fibrous, and very often there can be like a disc of tissue that develops underneath the nipple. And some people call that like a breast bud. So in the cases where somebody has this sort of thick fibrous tissue right underneath the nipple, I typically, in our practice, will typically remove that breast bud. So what that really means is making a little incision underneath the nipple, right at the junction of the areola, which is the pink part, and the skin. So that scar is really, really well concealed. And we make an incision there, and we lift up the areola tissue, and then we essentially cut out that thick, white, fibrous tissue for our patient. And then the other component of this is that there's sort of this fibrous, fatty tissue that surrounds it. Some guys just have that breast bud. Some people have that bud and a little bit of fibrous tissue around it. So for that, we typically use liposuction. In terms of the forms of liposuction, so because the tissue is so fibrous, we use something called ultrasound assisted liposuction. So essentially in liposuction in general, we inject fluid into the area that we're treating. So in this case, the male breast. And that fluid contains drugs which reduce blood loss and minimize pain. And then what we do is we place a little thin probe which shoots ultrasonic energy or high frequency sound waves through the area that we're treating. And what that does is it dislodges the fat cells from that area, from the fibrous tissue. And because of that energy, it allows us to kind of get through that thicker fibrous tissue more easily. And the heat that's generated from that can cause the skin to sort of contract, so that if there is some excess skin, that can tighten down as well. And then we suck that fat out. The scars or the incisions for that are tiny. They're just under 1 centimeter. And I typically will put them sort of in the sort of the lower chest. So kind of that's the edges of my ribs, sort of from here and here. I like to actually put them so that they're not even. And the reason is because if you have even scars, then somebody's going to think you had surgery. Whereas if they're uneven, you can make something up, like I had a mole removed or I had a hockey injury or whatnot. So those are where these tiny little scars are made. And we do all those steps. So putting in the fluid to numb it, shooting the energy through it, and then sucking out the fatty tissue through those tiny little scars. And then once all that's done, we then put compression on. So we often will use a foam and sort of a tight vest, which is placed to kind of stick everything down. And that prevents fluid from building up, and it helps to sort of mold the skin back down onto our patient's torso. The recovery for that is pretty good. So, everybody's a little different. We've literally had some people that have gone to work out within like 2 or 3 days of that surgery. I think for some people, for most people, I would say that they're probably off of like doing weightlifting and that sort of stuff for about 10 to 14 days. Again, everybody's a little different. We'd recommend that people wear that compression. I typically have people wear that for, most of the time for 2 or 3 weeks. And then at least for part of the time for a few weeks after that. Most gentlemen will find that it is more comfortable to do that, kind of prevents the tissues from rocking around a little bit, and works pretty well. So cutting out the breast bud, sucking out using ultrasound assisted liposuction, some of this fibrous tissue. Those are sort of the more common ways that we treat gynecomastia. Now that's not going to cut it for everybody. For some guys, they have too much excess skin. And so essentially their skin suit is too big for their frame. So for those individuals, we're looking at, essentially resecting skin. And if you go online to our website or other places, you'll see that there's a lot of different ways to do this. And really, I think the key is you always want to go to somebody certified by the American Board of Plastic Surgery or a fellow of the Royal College of Surgeons, somebody who's a board certified plastic surgeon who can kind of offer different techniques based on what the situation is. So when a plastic surgeon is looking somebody with lots of extra skin, the elephant in the room is also always the fact that if you're going to remove skin, you have to cut it out, and that means that there's a scar. So, we never want to put sort of a stigmatizing scar across a man's chest. So what we're trying to do is find ways to make the scar as inconspicuous as possible. So for some gentlemen, the skin can be so excessive and the nipple can actually be dropped down. And one of the ways that we can deal with this is we essentially amputate all that extra skin that sort of hangs below the lower fold of the breast. And so that's a pretty effective way of doing that. And so you may say, well, what happens to the nipple if I do that? Well, we actually remove the nipple right off of that tissue, remove all that skin so that the scars are kind of along the under surface, so we're at the very base there. And then we reapply the nipples as what are called free nipple grafts. And what that allows us to do is it allows us to put the nipples in a more masculine position. It allows us to reduce their size and allows us to reposition it without any additional scars kind of along the front of the breast. They're sort of on the undersurface. Some guys don't need that amount of skin resection. So in some cases, the scars are just around the areolas as well. And often if somebody's lost a lot of weight, we can actually remove their breast tissue from this scar and then do sort of a reverse tummy tuck through the same incision and pull them up at the same time. So the patient can get a little bit of a 2-for-1, removing some of this extra tissue here and then also tightening up some of the upper abdominal tissue as well. When somebody's having that kind of procedure, they're looking at drainage tubes to suck out some of the fluid. They're looking at us, trying to make nice, thin, linear scars, but oftentimes some sort of a scar management system with various products that we have to kind of limit scars to control for that. And then also compression, just like we talked about for other gentlemen who have gynecomastia. So to put pressure down on those areas, to stick down that tissue and make it a little bit more contoured. So nowadays, gynecomastia is, in other forms of male plastic surgery are much more acceptable than they used to be. So, about 90% of aesthetic surgery is done in women, but more and more year after year, more men are having aesthetic procedures. So not just gynecomastia, but liposuction in general is very common. Rhinoplasty, so contouring of the nose, eyelid surgery, so improving sort of a more tired appearance, descent of the brows and raising up the eyebrows and controlling some of these creases on the forehead, are just some of the areas that men may consider when having cosmetic procedures. Another thing I didn't really talk much about in terms of gynecomastia is there's something that many of you have heard of called Coolsculpting or freeze the fat. This is where we place unwanted area focused fatty tissue into an applicator that hyper cools that fat. And it turns out that your fat cells are more sensitive to the cold than the tissue that surrounds it. So what that means is you can sort of, in a more isolated way, damage the fat without damaging the rest of you. And the net effect of that is about 2 or 3 months later, a percentage of those fat cells die, 15-20% of those fat cells die, and then your body's immune system gets rid of them. And you can have a little reduction in the amount of fatty tissue you have there. So Coolsculpting or freezing the fat is now being used a little bit more for the treating of gynecomastia. In fact, some of our industrious trainees here at WashU and through West County Plastic Surgeons actually did a little study last year, and they were able to show that Coolsculpting can effectively handle sort of minor corrections of gynecomastia. In general, we think that surgery is typically a more effective strategy, particularly if there's a breast bud or if there's some excess skin. But for somebody who has just a small amount of excess fatty tissue, you could also consider Coolsculpting. And of course, there's really no downtime with that, and you could go to the gym the same day. All right. Well, with that, I think we've answered all the questions about recovery time and going to the gym. I really appreciate everybody tuning in, and please tune in again in the near future while we address other topics. Lisa will post some of our next interesting aesthetic surgery topics. We're looking forward to talking about other stuff in aesthetic surgery, physical therapy, after either cosmetic surgery or breast cancer reconstruction. And then also we'd like to do a little bit on yoga and on also nutrition and how that can make a difference in your lifestyle, and also how that relates to plastic surgery as well. All right, and don't forget to donate to somebody pedaling in the Pedal the Cause this weekend. Terry Myckatyn out. Hope you had a nice day. Bye.